Today we are going to discuss the clavicle, which is called as the collarbone, and it is anterior part of the pectoral girdle. And the girdle is actually the way of communication between axial and appendicular skeleton. So here we have two girdles, two extensions, two limbs. We have the lower limb and the upper limb. In the upper limb we have the pectoral girdle. In the lower limb we have the hip girdle or pelvic girdle, whatever we say. So this pectoral girdle, also called as shoulder girdle, it is made up of two bones, clavicle and the scapula. Clavicle is lying anteriorly in a region which is called as the pectoral region, and the scapula lying posteriorly in a region which is called as the scapular region. So the this clavicle, which is when we structurally classify it, it is a long bone, and it has a peculiarity because whenever you will see that all the long bones in the body, they are lying vertical. This is the only long bone which lies horizontal because it has to keep this appendicular skeleton of the upper limb away from the body, so it is lying horizontally. If it is lying horizontally, so we can say that all the long bones having two ends and shaft. Likewise, this clavicle also has two ends and the shaft. But in all long bones, we say two ends means upper and lower end because they all are lying vertical. But this is the long bone which is lying horizontal, so it has same two ends, but these two ends are, one end is medial, another end is lateral. So you can look at this, that it has two ends, medial and lateral end. And how we can identify that which one is medial and which one is lateral? So see this, the difference between two ends. See this end is you can see this is rounded or quadrangular, whatever you see here, and this end is flat. It is compressed. It is flat end. So it has two surfaces, superior and inferior, and this medial end, which is rounded or quadrangular, it has four surfaces: superior, inferior, medial, lateral. So whenever we look at, because not only that, this we have to describe this bone, but we have to actually determine the side of the bone, whether it is belonging to the right or left. So see that looking at the differences of both ends, we have one end, a circular rounded end. It is this rounded end is lying on the medial side. This flat end is lying on the lateral side. So we have these two ends. Then whenever we determine the side of a bone, we have to see the three differences: medial lateral, superior inferior, and anterior posterior. So medial lateral difference we have already seen, that this rounded end or quadrangular end, it is on the medial side, and this flat end is on the lateral side. Then you can see that this long bone, this clavicle is it looks like to be S-shaped. It is curved. You can see here that we have this curve here. So that you can see that this curve means that it shows somewhere it has the convexity, and then it has the concavity. Likewise, on other side we have the concavity and convexity. You can see here. So it has whatever on this rounded end, which is medial end, on this rounded end side, wherever the convexity, this convexity should be anterior. This is anteriorly present convexity, and the concavity is present on the posterior aspect on this medial end side. On the lateral end side, we see that concavity should be anterior and convexity should be on the posterior aspect. So we can say that on medial side it is convex forward, and lateral side it is concave forward. So we can say that this part is anterior side of the clavicle bone. You can see that because it is convex on this side, this quadrangular side, this is medial end. On medial end it is convex forward. On lateral end, you can see here it is concave forward. So this is anterior side, this is posterior side. Another difference, this medial lateral we have seen, anterior posterior we have seen. Another difference is that superior inferior. So when you look around this on the shaft of this bone, you see somewhere we can see we have a groove here, and not only this, but we see that we have some impression. This one, this is tubercle. This tubercle is always inferior. This tubercle is towards the lateral end side, this flat end side, you can see, and it is always inferior. So when we put this bone here, either it is belonging to the right or left. You see that if I say this is left side bone, suppose I put this like this, because this end should be on the medial side, you see, and on the medial side it has to be convex forward. You can see this is convex forward, this is medial end. Two things are correct whenever I put this on the left side. But you see that this tubercle it looks like to be at the superior aspect. It is lying superiorly. It has to be inferior. When I put this tubercle inferiorly, then you see that concavity becomes anterior. So then I put this bone on the right side. You see here that this is the medial side, medial end, quadrangular around it, and you see this convexity is forward on the medial end, and the tubercle is on the inferior aspect. This tubercle is on the inferior aspect. So we can say that this bone belongs to the right side. This is the right bone. Now looking at the features of this bone, you see medial end, which is quadrangular L. This quadrangular medial end, it articulates with the upper part of the sternum, which is called as the manubrium of the sternum. This manubral part of the sternum articulates with the medial end of the clavicle to form a joint, that joint lying between the sternum and the clavicle. This is called as the sternoclavicular joint. Here you just imagine this is a sternum, and then this clavicle articulates like this. This is sternoclavicular joint. Okay, and lower down, you see it is a quadrangular. On the medial side we have this is quadrangular. It has four surfaces. We have the superior surface, we have the anterior surface, we have the posterior surface. All these surfaces are smooth, and we have the inferior surface. Only the inferior surface having some notch here, this is called as the facet. This facet articulates with the first costal cartilage. So the joint is called as costoclavicular. Between costal cartilage and clavicle, joint is called as costoclavicular joint. So we have two joints on the medial side. One is that medial end articulated with the sternum, sternoclavicular joint. Another is that inferior surface of the medial end is articulating with the first costal cartilage to form the costoclavicular joint. Then looking at the lateral side, you see lateral side is flat. So it has two surfaces. This is superior surface and this one is inferior surface, and it is two borders. This is anterior border and this is posterior border. You can see this is posterior border. Okay, so two surfaces, superior surface. This superior surface having the peculiarity to form the summit of the shoulder. When you touch your shoulder from superior aspect, you can feel two things. It is the lateral end of the clavicle and another process of the scapula, which is called as the acromion process. These both are forming the summit of the shoulder. So this superior surface of the lateral end, and we have another inferior surface of the lateral end, and having the anterior border and the posterior border. So you see that now on the lateral end, superior surface is smooth. You can see this is smooth. Inferior surface, we have this tubercle. This tubercle, because it is cone shaped, you can see here, this is cone shape. This is called as the conoid tubercle. From this conoid tubercle, a ridge arises that goes, you can see that goes anteriorly and laterally. From the conoid tubercle goes anteriorly and laterally. This is called as the trapezoid ridge, because a part of the ligament attached to it, part of the ligament is trapezium shaped, so it is called as the trapezoid ridge. So we have on the inferior surface of the lateral end this conoid tubercle, and from the conoid tubercle going anterolaterally, this is the trapezoid ridge. Okay, these both conoid and tubercle and the trapezoid ridge, they are for the attachment of the ligament here. We will discuss later on. Okay, so we have this anterior border and posterior border. Now when we go, we have seen the medial, on the medial side it is quadrangular, it has 4 surfaces. Okay, on the lateral it is flat, it is flat. Now from this quadrangular it becomes flat. So actually the bone changes its texture at the junction of medial 2/3 and lateral 1/3. Here it is the junction, you can see here. This one is the medial 2/3 here, and then we have the lateral 1/3. This is the junction. The bone at this junction, bone is slender and thin, and bone can be damaged here whenever there are pressures over here, and whatever the fractures occur, frequently they are occurring at the junction of medial 2/3 and lateral 1/3, because the bone is thin and slender here, and it cannot sustain the pressures, and the fractures most commonly they are occurring here. Okay, at the shaft you can see that no any important that we can see that in all direction this shaft is smooth, but at the middle part, low inferior aspect of the middle part, you can see that we have a groove here. This groove is called as the, because it is lying below the clavicle, this groove is called as the subclavian groove. It is for the attachment, this subclavian groove having peculiarity that the nutrient foramen for the clavicle is present inside this groove, and it is for the attachment of a muscle, that muscle having same name, subclavius muscle. So you can see here, these are the gross features of the clavicle. And lateral end, I must explain this lateral end of the clavicle, it articulates with a process of the scapula that is called as the acromion process. So the joint is called as acromioclavicular joint. Here laterally it forms acromioclavicular joint, medially it forms sternoclavicular joint. Okay, this long bone, because having the specialty that it is the only long bone in body that lies horizontally, it has other peculiarities as well. These peculiarities are that it is the only long bone in the body which is ossifying first to ossify. All the bones, they are ossifying in the 8th week of intrauterine life. This bone is ossified from the 7th week of intrauterine life. This is only the long bone which ossifies. Other long bones, when we look at them, they are ossifying from the cartilage. This is the only long bone which ossifies from the membrane. When we look, another specialty is that when we look at the long bones, they have one primary and multiple secondary centers. But this is the only long bone which having 2 primary centers. This is the only long bone which having 2 primary centers. Another specialty is that this is the only long bone you can feel throughout your skin. No any long bone you can feel throughout the skin. This is the only long bone you can feel throughout the skin. So these are some special features, some peculiarities. You can notice them and might be asked about this. So this is all about the clavicle. Okay, thank you very much.